2E, and our topic is about critical thinking. My group members are Jada, Jingyi, Barbara, Violet, and myself, Catherine. Are you a critical thinker? Do you seek for clarification when you do not understand? Will you suspend conclusion until you have all the necessary information? Do you eliminate irrelevant data from unimportant and significant data? Are you someone who turns mistake into learning opportunities by determining what went wrong and by thinking of ways to avoid those errors in the future? What about weighing the credibility of your sources that are used to rationalize your principles? If yes, you do, then you are a critical thinker. According to Paul and Elder, critical thinking is that mode of thinking about any subject, content, or problem in which the thinker improves the quality of his or her thinking by skillfully taking charge of the structures inherent in thinking and imposing intellectual standards upon them. According to Hatcher and Spencer, critical thinking is thinking that attempts to arrive at a judgment only after honestly evaluating alternatives with respect to available evidence and arguments. Next, Violet is going to discuss about the key terms and importance of critical thinking. Next, Violet is going to discuss about the key terms and importance of critical thinking.
The key terms related to critical thinking are rationality, that means being reasonable based on fact rather than emotion. Honesty, it refers the fact of moral characters and tell the truth. Open-mindedness, it is to be reminded open mind to receive the new ideas from others. Self-awareness, to understand your own personality, your own habits, behavior, and your own emotional reactions. Analysis, use understanding of concept or situation by identify constitutional parts. Discipline, avoid impulses, judgment, logic, argument. An argument is attempt to persuade someone of something by giving reason for accepting a particular conclusion as evidence. So the important, why my topic is important is critical thinking help nurses to make right decisions which are more ethical. Nurses can provide appropriate interventions which can enhance the quality of care to client. It helps reducing the risk of adopting, acting or thinking with false beliefs. Not only in the nursing field, but it also impact on the individual of casual life to make better and right informed decisions. By using critical thinking, nurses can get fact data by asking questions, evaluate and reconstruct to the situation and make a good care plan which help in making better decision and choice. Not always the nurse's knowledge and information is correct, so it provides self-correction and working-based evidence than personal performance or belief. Critical thinking is important to analyze situation, provide some alternative ideas to make a decision that help in the care plan of patient. It helps every individual to acquire knowledge, get right information, improve related theory, strengthen argument, and hence come up with better conclusion and eventually decisions. Now Barbara will discuss the uses of critical thinking and how does it is applied to the real world.
What are the uses of critical thinking? Nursing is an applied discipline. Nurse must know how to identify knowledge and data gaps, find and use new information, and initiate and manage change. Nursing draws on knowledge from other fields. Nurses use information and insights from other subject areas such as physiology, psychology in order to understand the meaning of patient data and to plan effective interventions. Nurses deal with change in stressful environments. Nurses must base their decisions on knowledge and rational thinking in order to respond appropriately under stress. Nurses make frequent, varied, and important decisions. Nurses use critical thinking to collect and interpret information and to make sound judgments and good decisions. How does it apply to the real world? Give specific examples. Critical thinking is essential to the nursing process. According to the American Nurses Association, the nursing process provides the framework for critical thinking in nursing. Nurses use critical thinking at each stage of the process: assessment, diagnosis, planning, outcomes, planning intervention, implementation, and evaluation. The next speaker will be Jingyi, and she will discuss relationship to nursing theory and how it influenced thinking.
Critical thinking has a relationship with nursing theory. Basically, the main components in nursing theory are nursing, client, health, and environment. For example, based on Nightingale's environmental theory, as nurses, we should use critical thinking to consider these four components. Firstly, nursing. Nurses provide optimum care for client. Secondly, client. Client-centered care. Client as passive person influencing environment or nurse. Nurses are in control of and responsible for patients' environment and their choice and behaviors. Thirdly, health. Nurses maintain the health through prevention of disease, while the environment. Lastly, environment, like ventilation, warmth, light, and absence of noise. In general, nurses should create a therapeutic and comfortable environment to enhance patients' recovery. Nursing theory as a basis for critical thinking. They apply the critical thinking in practicing based on nursing theory. Critical thinking is the key in nursing process and successfully management clinical situation. Nurses strength professional power when using theory as systematic guide for critical thinking and decision making. Although there is a mutual effect between nursing theory and critical thinking. Critical thinking influences thinking. It is a process of analyzing our own thinking, develop tools for rigorous thinking process, and directing and guiding our own thought, like what is the best for the client. Now, Jaden will explain the relevance to nursing practice.
She is also complaining of lack of sleep. The patient has a medical history of COPD and hypertension and is a smoker. The nurse also notices crackles, wheezing on her lungs, and edema in both lower extremities. Vital signs are blood pressure at 130/80, pulse at 90, respiratory rate at 28, temperature at 36.6, and O2 sat at 80%.
Hi, I'm Jenny, your nurse. And now I'm gonna ask you some questions about your daughter's the health status. So, what brought you to here today?
She had a difficulty breathing from last night,
Mhm.
so she can't sleep, and he had a cough also.
Mm-hmm.
So she can't sleep whole night. She just relax if I put 2-3 pillows under the neck.
Okay. So, what is her past medical history?
Yeah, she had some chest problem also, breathing, and she's hypertensive also.
Tension.
Yeah,
Mm-hmm. So, does her smoke?
yeah, she does.
Smoker.
Yeah.
Okay. So now I'm gonna take your vital signs first, and I'm gonna assess your. Yeah.
When are you calling doctor?
In a few minutes
Okay.
after I finish the assessment. Okay. You check your blood pressure and check your pulse.
Just relax.
You check your. Oh, your oxygen level is low. And you're gonna put your oxygen on. To here. Now I'm gonna ask you to take deep breaths for a moment, okay? Deep breaths. Okay. Deep breaths. Okay.
Yeah, put your
Okay.
relax.
Now I'm gonna assess your leg, okay?
Okay. I think legs are okay.
I found your leg. I feel some like swelling. So how long did you find this swelling?
I never feel swelling.
You know?
Yeah.
You're not sure?
There is?
Okay, it's fine. So the doctor will be see you in a few minutes.
Okay.
So I will check you again after the doctor see you.
Okay.
Okay?
Okay.
Yeah. Hello, Dr. B. I'm nurse from emergency room. I'm GE. I have a patient on bed 8. She come this morning with a difficult breathing, and I already started the 2 liter of oxygen, and her vital signs is blood pressure is 130/80, and respiratory rate is 28, and ultrasound is 18%. So I recommend you to take to order the ECG, okay? Okay, ECG. Okay, thank you, Dr. B. Bye.
The doctor came down and see Barbara. She ordered some medications, including digoxin, 0.25 milligram.
Okay, it's time to take the medication. So let me check your pulse first. Okay, I have to hold your medication for now because your pulse is a little bit lower. So I'm gonna report your doctor, and let's see what is his recommendation. All right, I will check after 1 hour.
How much
Okay.
is the pulse?
The 58.
58.
Yeah. Okay.
It's okay, okay? Just relax.
Hello, Dr. B. I'm Jean from the emergency room. Mrs. Barbara is your patient. I hold the medication digoxin because her pulse is 15.8 now. So would you like to come to see her? Okay, you will? Okay, thank you very much, Dr. B. Bye.